am Dr. Edna Amaro. I am from LIP Fertility Center in Puerto Vallarta, Mexico. Today, we are going to talk about how can you prepare yourself for your IVF cycle. We are going to give you 10 tips, and we hope that you find this video super helpful. So tip number 1 will be quit smoking and drinking. Throughout all these years of investigation, it has already been said how can the nicotine affect the reproductive treatments. Speaking about the female affections and the outcome of the IVF cycles, we have seen that nicotine affects the aging of the ovaries, the egg quality, and also the implantation process. Meanwhile, in the male affection, we can consider a decrease in the motility in the spermatozoa and also in the morphology. So for that, it's very important that you prepare yourself with this recommendation. Tip number 2 is to take your vitamins and supplements. So it's important that you remember that fertility-enhancing vitamins are lacking in the Western diet. Remember that the cells are formed with the nutrients that are or are not available in your body. So for that, that's the important for you to taking these recommendations. Most of the time, we find out that the female are benefit when taking omega-3, vitamin K, astaxanthin, vitamin D, sometimes DHEA, and also their prenatal vitamins. But in the other side, male patients have also to take, for example, supplements that contain zinc, L-carnitine, and other recommendations that depend if they have problems in their semen sample analysis. Tip number 3 is about eating fertility-enhancing foods. So remember that are a couple of food that you can actually increase in your diet because it's like a boost to having a better cycle. So just to mention some of these, I will recommend you berries, Greek yogurt, spinach, artichokes, salmon, or even quinoa. Just remember that trying to be most close to a healthier diet is the best for the IVF cycles. Try to avoid all fat diets and spicy ones that obviously can affect your treatment. Tip number 4 is trying to stay close to a normal BMI. In male patients, an obesity and the overweight are two important factors that affect the motility and morphology of the spermatozoa. And in female, obesity and overweight are going to increase the probabilities of having miscarriages, developing diabetes during the pregnancy, as well as high blood pressure. Tip number 5 will be about improving your sleeping. For that, I can give you a couple of recommendations to have a better one. So recommendation number 1 will be to have a routine with you and your partner. That means that you have to try to go to bed and wake up just at the same time. Also, I recommend you to avoid taking caffeine or alcohol just before going to bed, because both of them are going to alter your healthy cycles sleeping, and it's better not to take them before going to sleep. Tip number 3 is to try to exercise before going to bed. In that way, you can help your body to release all your stress of all the day. And also, you may take some type of melatonin just to help your body to reach a deep sleep.